Look, I'm going to be straight with you right from the start. In my 30 plus years practicing urology here in Canada, I've had thousands of men sit in my office worried sick about whether they're normal down there. And here's the thing that might surprise you: 95% of them are absolutely fine. 95%. Let that sink in for a moment. If you've ever felt anxious about your size, you're likely in that 95% who are worrying about nothing. I'm Dr. Hannah McLeod, and I've been a urologist for over 3 decades, mostly here in Ontario, though I've worked with patients across the country. I've seen it all, heard every concern, and I can tell you with complete confidence that the anxiety you might be feeling, it's far more common than any actual medical issue. Today, we're going to tackle a topic that's caused more unnecessary stress than probably any other aspect of men's health. What's a normal penis size? How do you measure it properly? And most importantly, does it actually matter as much as you think it does? With the rise of cosmetic procedures and the frankly overwhelming amount of misinformation online, these questions are coming up more and more in my practice, in online forums, and honestly, everywhere men gather to talk. But before we dive into the numbers and the measurements, I want to address something that's probably been weighing on your mind. You know what question I get asked more than anything else? Not what's the average size, but rather, Dr. McLeod, does it really matter? And gentlemen, that's actually the most important question we should be answering first. So let's talk about that elephant in the room, shall we? Does penis size actually matter? I've done informal surveys with my patients over the years, and the data from larger studies backs this up beautifully. About 55% of men report feeling insecure or dissatisfied with their size. That's more than half of you. But here's the kicker. When we survey women about what matters to them in a partner, only 5 to 10% say that penis size is a very important factor. 5 to 10%. Think about that gap for a second. More than half of men are worried about something that less than 10% of women actually care about. In my experience, and I've had countless couples in my office over the years, what partners actually value is emotional connection, attentiveness, and yes, technique matters far more than size ever will. I've had men with larger than average sizes struggle with relationships, and I've had men on the smaller end of the spectrum who have incredibly fulfilling intimate lives. The common denominator? Confidence and caring about your partner's experience. Now, I know what some of you are thinking. That's easy for you to say, Dr. McLeod, but I've seen things online, I've been in locker rooms, I've compared, and that's precisely the problem, isn't it? We're comparing ourselves to unrealistic standards. Think about it. The adult entertainment industry specifically selects performers based on unusual size. That's like comparing your driving to a Formula One racer or your cooking to a Michelin star chef. And even then, there's camera angles, editing, all sorts of tricks to exaggerate what you're seeing. It's about as realistic as a Tim Hortons commercial making a double-double look like the elixir of life. The other thing that happens, especially in locker rooms or communal showers, is that you're typically seeing other men in a flaccid state while comparing it to your own from a downward viewing angle. That's going to make theirs look bigger and yours look smaller automatically. It's just physics and perspective, not reality. All right, now that we've addressed the anxiety piece, let's talk about actual measurements. Because if you're going to assess anything, you need to know how to measure properly. And I've got to tell you, I've had plenty of men in my office who've been measuring wrong for years and working themselves up over nothing. There are 2 main measurements we look at in urology: length and girth, or circumference if you want to be technical about it. The penis length can be measured either in an erect state or in what we call the flaccid stretch state. And both methods are used in scientific research. However, the most consistent and clinically reliable method is measuring the stretched flaccid length, which correlates very closely with erect length. So if you're too shy or it's too awkward to measure when erect, the stretched measurement works just fine. Here's how you measure length properly. First, you'll need a ruler or a measuring tape. A standard ruler from your desk drawer works perfectly fine. Second, place it at the pubic bone, right where your penis meets your body. Now, you might need to press down slightly on the fat pad to reach the actual bone underneath. Don't worry, you're not going to hurt anything. We all have some fat there. It's completely normal. Third, stretch the penis out. Not forcefully, mind you, but firmly, and measure to the tip of the glans, that's the head. If you're measuring in the erect state, it's the same process. Start at the pubic bone and measure to the tip, keeping the ruler aligned along the top of the shaft. Here's what you absolutely must not do. Don't measure along the underside or from the side, because that'll give you extra length and lead to inaccurate numbers. I've had guys come in, convinced they're below average because they measured one way, then relieved to find out they were perfectly normal when measured correctly. It's like weighing yourself with your boots on and then wondering why the number's higher than expected, eh? Now, for girth or circumference, which is equally important and can vary quite a bit from person to person. To measure this, first get a soft measuring tape. You know, the kind tailors use. If you don't have one, you can use a piece of string and then measure the string against a ruler afterward. Second, wrap it around the middle of the penis shaft, not too close to the base and not near the tip, right in the middle. Third, note the measurement where the tape meets itself. You can do this measurement in both flaccid and erect states for comparison, though in most studies, the erect circumference is the standard. Many men tend to overestimate or underestimate their size because of poor measuring techniques or because they're comparing their own body in a non-erect state to other men in a fully erect state, which leads to completely unrealistic expectations. I had a patient once, nice fellow from Winnipeg, who was convinced he was below average because he'd spent years comparing himself to images online. When we did a proper measurement in my office, turned out he was bang on the average. Years of anxiety over absolutely nothing. So, now that we know how to measure properly, let's look at what science actually tells us. There was a large-scale meta-analysis conducted with data from almost 15,000 men worldwide. This type of study combines data from many different research projects to establish reliable averages. These aren't just numbers pulled out of thin air. This is solid, peer-reviewed research. For length, in the erect or flaccid stretch state, about 90 to 95% of men fall within the following range, between 12.5 to 16 centimeters. That's roughly 5 to 6.25 inches for those of you still thinking in imperial. The global average length is about 13.2 centimeters, or just over 5 inches. So if your size falls within this range, you're completely normal. You're right there with the vast majority of the population. Now, at the extreme ends of the spectrum, there are medical definitions. A micropenis is defined as a stretched length of less than 7.5 centimeters, about 3 inches. A macropenis, which is very rare, is generally considered to be over 24 centimeters or about 9.5 inches. However, keep in mind these are statistical outliers and they represent only a tiny fraction of the population. We're talking less than 2% on either end. For girth, the average also varies, and the majority of men fall into a typical range. The flaccid stretch circumference is between 8 to 10.5 centimeters, which equals about 3 to 4 inches, with an average of 9.5 centimeters or about 3.75 inches. The erect circumference ranges from 10 to 13 centimeters, roughly 4 to 5 inches, with an average of 11.5 centimeters or about 4.5 inches. So when people talk about the average, these are the actual numbers they're referring to. Unfortunately, many men measure themselves against unrealistic standards, particularly those from adult films, where actors are specifically selected for their unusual size. And even then, perception is exaggerated through camera work, angles, and editing. The bottom line is simple. If you fall within these ranges, you're part of the vast majority. And even if you're outside the norm, that's not a measure of your health, attractiveness, or masculinity. I've been doing this long enough to tell you that with absolute certainty. Before we continue, I want to address some common myths I hear all the time in my practice, because misinformation causes so much unnecessary worry. Let's bust a few of these right now, shall we? Myth number 1, shoe size or hand size correlates with penis size. I cannot tell you how many times I've heard this one. Gentlemen, there is zero scientific evidence to support this. None. Zilch. Your foot could be a size 7 or a size 13, and it tells me absolutely nothing about what's going on downstairs. If this were true, every shoe store in Canada would be a lot more awkward than it already is. Myth number 2. Bigger is always better. As we talked about earlier, survey data shows that the vast majority of partners don't prioritize size. What they do care about is attentiveness, emotional connection, and frankly, whether you're putting in effort. I've had countless conversations with couples where size was never the issue, but communication was. Fix the communication, and suddenly the bedroom situation improves dramatically. Myth number 3, you can significantly increase size through exercises or devices. Look, I've seen every gadget, every pump, every exercise program marketed online. The truth is that while some techniques might create temporary swelling or slight improvements in blood flow, there's no exercise that's going to add inches to your length. The penis isn't a muscle you can train at the gym. If it were, well, we'd all be in much better shape, wouldn't we? Some devices can cause harm, actually, leading to nerve damage or tissue injury. Save your money and your health. Myth number 4, everyone else is bigger than me. This goes back to the comparison issue. You're seeing yourself from the worst possible angle and others from better angles. Plus, as I mentioned, you're often comparing flaccid to erect states. It's an unfair comparison that your brain is making automatically. Once you understand the actual statistics, you realize that most everyone is in the same boat, so to speak. Now, let's talk about something that's becoming increasingly common in my practice: cosmetic procedures for penis enlargement. With the rise of medical aesthetics, more men are considering these options, and I think it's crucial to understand what's actually safe, what works, and what you should absolutely avoid. One of the most common cosmetic procedures targets girth enhancement. The most frequently discussed method is the injection of hyaluronic acid. Hyaluronic acid is a substance naturally found in your body, and it's also used in facial fillers. When injected along the penis shaft, it can temporarily increase circumference by about 2 to 3 centimeters. The effect lasts roughly 12 to 18 months, depending on the product and your individual metabolism. This method is considered safer than other substances because it's absorbed by the body over time. However, not all injectable materials are safe. Some clinics offer non-absorbable fillers like PMMA, that's polymethyl methacrylate, or even industrial silicone. These substances can lead to serious complications, including chronic inflammation, hard nodules, deformations, and irreversible tissue damage. I've had to treat men who've had these procedures done abroad or at questionable clinics here in Canada. And let me tell you, the complications can be devastating. These materials are not recommended by reputable medical societies, and there's a good reason for that. When it comes to lengthening procedures, the options are even more limited and riskier. Sometimes 2 procedures are offered. The first is liposuction in the pubic area, where fat around the base of the penis is removed, making more of the shaft visible. While this doesn't lead to actual lengthening, it can improve the external appearance. I've had a few patients opt for this, particularly men who've gained weight over the years and noticed that, well, things seem to have shrunk. In reality, nothing's changed size-wise. There's just more fat covering the base. Remove that fat, and suddenly there is more visible length. The second procedure is called suspensory ligament release, a surgical intervention where the ligament holding the penis close to the pubic bone is cut. This can increase visible length in the flaccid state by about 2 to 2.5 centimeters. However, it does not change the length in the erect state. Moreover, it can lead to instability during intercourse and carries risks of complications and scar tissue. I generally don't recommend this procedure unless there is a specific medical indication. It's important to emphasize that there are no permanently approved methods for true penis lengthening that are recommended by the Canadian Urological Association or most international medical organizations. The risks often outweigh the benefits, and the results are frequently disappointing. Finally, I need to clarify that penile implants, which are often advertised online, are not meant for size enhancement. They're medical devices for treating erectile dysfunction and are only recommended in specific cases. If you're experiencing ED, that's a different conversation entirely, and there are good treatment options available. But using implants purely for size, that's not what they're designed for. You know, after 30 years in this field, I've learned that sometimes the best medicine is perspective. So let me share something with you that might change how you think about this whole size issue. In ancient Greek culture, the ideal male body was often depicted with a smaller penis, which was considered a symbol of wisdom, self-control, and reason. In contrast, large penises were frequently associated with barbarism, lack of discipline, or even humorous exaggeration. If you look at sculptures of famous gods and philosophers, you'll notice that none of them are depicted with exaggerated anatomical features. And when large penises appeared in art, they were often part of caricatures or depictions of mythological figures like Priapus, the fertility god, who was portrayed grotesquely and exaggeratedly. Why does this matter? Because it shows us that cultural notions of masculinity and body size change over time. What's considered ideal in one era can mean exactly the opposite in another. This tells us that many of the anxieties that exist today regarding body size are shaped more by social influences than biological facts. The ancient Greeks, who basically invented Western philosophy and democracy, thought smaller was better. Meanwhile, we're over here in the 21st century worried about the opposite. It's almost funny when you think about it, eh? If you've ever felt insecure or pressured because of images from the internet, the media, or conversations in the locker room, you're not alone. Trust me, I've heard it all in my practice, but I hope this video helps put things in a clearer perspective. Your worth as a man, your ability to satisfy a partner, your masculinity, none of these things are defined by penis size. What really counts is your confidence, your respect for others, and your health, both physical and emotional. I want to take a moment here to speak directly to those of you who might be feeling a bit embarrassed even watching this video. In my 3 decades of practice, I've had everyone from young men in their 20s to gentlemen in their 80s sit in my office with these exact same concerns. Age doesn't make these worries go away, unfortunately. But here's what I tell everyone. Seeking information, trying to understand your body better, that's not something to be embarrassed about. That's being proactive about your health, and that's exactly what you should be doing. For my older patients especially, I know there can be additional concerns. Maybe things have changed over the years. Maybe you've noticed differences in firmness or size compared to when you were younger. That's normal. Our bodies change. Just like our hairline recedes and our joints get a bit creakier, yes, there can be changes down there too. But understanding what's normal aging versus what might be a medical concern, that's important. And it's okay to ask about it. If you're noticing changes in your ability to achieve or maintain an erection, that's something we should definitely chat about with your family doctor or a urologist. It could be related to circulation, hormone levels, medications you're taking, or a bunch of other factors that are very treatable. Don't suffer in silence thinking it's just getting old. We've got options these days, good ones that can help. But if you're just worried about size, if you've spent years comparing yourself to unrealistic standards and it's been weighing on you, let it go, seriously. You've got better things to worry about. Life's too short to spend it anxious about something that 95% of you are completely normal about anyway. I also want to address something for those of you in relationships. If your partner has never complained, if your intimate life has been satisfying, then why are you worrying? Often these anxieties are entirely internal. We create problems that don't actually exist in our relationships. I've had men come in, convinced their partner is unsatisfied, only to have the partner sit there baffled because they've never even thought about it. Communication, gentlemen. It's so much more important than size. And for those of you who might be single or dating, I'll tell you what I've observed over the years. Confidence is attractive. Anxiety and insecurity are not. If you're walking into an intimate situation already worried about whether you measure up, that's going to affect your performance far more than your actual size ever could. But if you go in confident, attentive, and focused on connection, that's what makes the difference. Look, I get it. We live in a world where we're constantly bombarded with images and messages about what we should look like, how we should perform, what real men are supposed to be. It's exhausting. But here's the thing. Most of that messaging is trying to sell you something. Whether it's pills, procedures, or insecurity itself, someone's making money off your anxiety. Don't give them that power. Your body's your body. If you fall within the normal range, and statistically you almost certainly do, then you're fine. Perfect even. And if you happen to be on one of the extremes, you know what? You're still fine. I've had patients on both ends of the spectrum living full, happy, healthy lives with satisfying relationships. Size is just one tiny factor in the incredibly complex equation of human intimacy and connection. So here's my advice after 30 years of doing this work. Focus on what you can control, your health. Keep your cardiovascular system in good shape because what's good for your heart is good for everything else, if you know what I mean. Your relationships, invest time in emotional connection and communication. Your confidence, work on accepting yourself as you are. These things will do far more for your intimate life than an extra centimeter or two ever could. If you're still feeling anxious after watching this, if you've measured yourself and you're genuinely concerned there might be a medical issue, then by all means, book an appointment with your doctor. That's what we're here for. But I'm willing to bet that for most of you watching this, you're going to measure, realize you're completely normal, and hopefully feel a weight lift off your shoulders. And please, for the love of all that's good, be very careful about where you get your information online. There's so much nonsense out there, so many scams and dangerous advice. Stick to reputable medical sources. Talk to actual healthcare professionals. Don't trust some random website trying to sell you miracle pills or devices. I hope this video has been helpful. I know it's not the easiest topic to discuss, but it's an important one. Too many men are walking around with unnecessary anxiety, and if I can help ease that for even a few of you, then it's been worth making this video. Remember, you're normal, you're fine, and you're far from alone in having these concerns. If you found this information useful, I'd appreciate if you could give this video a like and subscribe to the channel. I put out videos on all sorts of men's health topics, always based on science and my decades of clinical experience. And honestly, drop a comment below. What questions do you still have? What other topics would you like me to cover? This is a safe space, no question is too embarrassing, and I read and respond to every comment. We're all adults here, and your health matters. Thanks for watching, everyone. Take care of yourselves, and remember, confidence and health matter far more than centimeters. Cheers!